Thank you for joining for the second part of our interview with Dr. Mulder Craig, sexologist and expert treating women with sexual pain. Thank you so much, Doctor, for joining us.
You're welcome.
Really having the most wonderful time to listen to you and hear about the amazing work that you do. You mentioned to me that you are actually an activist. And you were an activist in heart since a long time ago, but when you were 25, which was 5 years ago. But you are an actual activist for sexual pain for women. Tell me more about it.
I think it's because I'm so passionate about it. It's because I want to see myself as an activist, and that's why it's so important for me to have this discussion and talk about it, because I see so many women with sexual pain disorders, not realizing at first, that it's actually a real physical problem. It does become emotional and have a psychological impact and also on your relationship. But I think for me it's so important that people understand, women, that they go from one specialist to the other, or a gynecologist or the GP or the urologist or whomever, psychologists, wanting and asking for help, not understanding what's really going on. And then when they eventually get to me and my team, and we specialize in terms of the treatment of sexual pain disorders within a multi-professional team, then they suddenly realize, oh, but this is so something now, it has a name, a diagnosis, there's a treatment plan. There's a whole team of mostly women behind you, so suddenly they don't feel so alone anymore. So I think that's why it's so important for me, because many people, for years and years, many women would, men can have sexual pain as well, but if we now focus on women, experience pain for years, not really understanding that it's not supposed to be like that. And then the moment that they treat it and that they can actually have pain-free sex and penetration, it's like a whole new world opens up.
When you treat women that experience sexual pain, where does it usually orient? Where is usually the origin of it? Is it something that really is something physically wrong with the body? Maybe there is maybe it's a very tight, nerve system area, or is it many times because of trauma? What do you see more in your practice?
It's a very good question, and I think it depends. But very often it's a physiological issue. It's a pudendal nerve that's hyperactive, or hypertonic pelvic floor, or pelvic floor dysfunction, and that's something you cannot see. So if you go to the doctor and he says, well, everything looks fine, just drink a little bit more wine, or just relax and everything will be fine, or let's cut it open because it's too small.
Oh gosh.
Obviously that won't help either, hey? So these
goodness.
poor women, and I think that's why I'm so passionate about it, because it feels like they, sometimes the system also traumatizes you.
Oh my word.
And so there's a specific, so yes, it can be physical. Often something like the pill. If you've been on the birth control pill for years, it can create that kind of pain.
Wow.
Other types of medication, just being anxious and stressed. Sometimes you've had many infections, blood infections, vaginal infections, you have lower back pain, or IBS. That's also linked to the pelvic floor.
Yes.
So everything is interlinked. And then if you look at it holistically and you say, well, we need to teach you how to relax and to breathe, to come back into your body, to know and understand it's safe. Yes, sometimes there is sexual trauma as a child, but if I hear sexual trauma, I don't necessarily say, oh, ring, ring, that's a problem.
Okay.
You first deal with the basics, all the, you know, the other stuff, the obvious, your hormones, what's going on with your hormones. Very often there's an issue there as well, even your thyroid. So we need to look at what's happening in your body and then say, okay, now we can. So then treatment would very often be no sex. So immediately we take no penetration, we take away that pressure of we have to have sex, and if we do, it's going to be painful. And the poor partner also, very often we see that he gets erectile dysfunction or some sort of sexual issue because he doesn't want to feel like he hurts her all the time, or that it's so difficult to penetrate, sometimes impossible if it's vaginismus. The pelvic floor muscles, the pubic muscles go into spasm. It's impossible. And people don't understand because we think sex is perfectly normal and naturally perfect, so we don't understand. And very often these are people that high flyers, achievers, A-type personalities, so they're very driven, and 12-year-old kids can have sex, but they can't, you know. So if you can't wear a tampon, if it's painful, then lights going on, then please go and see a sexologist, and know that we have a team. Like, you have to have physiotherapy, for example, you have to add medication, you have to add therapy in general, and then, I mean, it's just amazing what you can achieve in actually a very short period of time. And most of the work those women and couples go and do at home, we just guide them and give them a safe and a contained space and the understanding of, oh, this is what it really is.
So the biggest thing that I'm taking from what you're saying, which is really almost newsflash, is not to go to a gynecologist necessarily if you're experiencing pain first thing. Maybe to look for the sexologist that is expert in that. Because I think going from one doctor to the other can be so daunting. And you actually lose faith that anybody can help you. I had so many experiences. Just going to a gynecologist, I had to do an x-ray of the uterus. It was the most traumatic experience of my life. They tried to shove liquids into the uterus without anesthetic. I remember I said, I just don't trust anymore the medical system. And the first thing that I think is, let me go to a gynecologist if I have something wrong. And actually, it's a big, big sign for me. It's a big, bold, in bold letters sign. Go to a sexologist. Go to a person who's really qualifying and expert in that field.
It's so important, and in our clinic, the My Sexual Health clinic, we work within that team. But it's important to, if you decide to see a sexologist in South Africa, to make sure that they're registered with the healthcare, HBCSA, or with a professional body. And
I think around the world.
Word of mouth.
Around the world, check the registered, make your own due diligence.
Because it's very important.
Where can people find you? Where can people even get treated by you, online or face-to-face? Give us a bit of information.
I do online counselling, also face-to-face in Pretoria. And if they want any more information, they can visit my website at drmuldercraig.com.
This has been so insightful. I know it's only the tip of the iceberg, but I trust that many women are hearing this useful and so important information to actually know what at least to do in the next step. There is a way, and there can be pleasure in the end of the tunnel. Thank you, doctor.
Thank you.
This has been so insightful. Thanks.